My name is Kathleen Melendi, and I'm the Massachusetts State Director for Reproductive Equity Now. Thank you for the opportunity to testify today in support of House Bill 4838, an act expanding access to perimenopause and menopause care. As a state and regional organization, Reproductive Equity Now works in Massachusetts and across New England to make equitable access to the full spectrum of reproductive health care a reality for all people. Advancing reproductive health, rights, and justice, and working to eliminate barriers to abortion care are essential to our mission. We support 4838 because perimenopause and menopause are critical and often overlooked phases of the reproductive life cycle. Each day, approximately 6,000 people in the United States reach menopause. Many experience years of disruptive symptoms and increased risk of serious conditions such as osteoporosis and cardiovascular disease. And yet, despite the fact that the average American woman spends roughly 40% of her life post-menopause, this life stage remains under-researched, undertreated, and shrouded in silence. H4838 is an important step forward in recognizing perimenopause and menopause as essential life phases that deserve attention and investment. The Legislative Commission will collect long overdue data and develop evidence-based recommendations, allowing us to identify gaps, address disparities in care, and craft more responsive policy. At a time when the Trump administration continues to slash federal health research funding, it is more important than ever for Massachusetts to lead on a state level. 4838 also prioritizes public education for both the public and healthcare workers. This will reduce stigma, support earlier diagnosis, and empower patients to seek the care they need. It also strengthens provider training by requiring continuing education in the diagnosis, treatment, and management of perimenopause and menopause, helping our providers to offer their patients informed and compassionate care. Finally, this legislation acknowledges the real impact perimenopause and menopause can have in the workplace. According to the Society for Women's Health Research, 2 in 5 people have considered leaving or have left their jobs due to their menopause experience. Expanding employment protections and reasonable accommodations supports economic stability, dignity, and workforce retention. True reproductive equity means ensuring that no one is left to navigate this transition alone. H4838 addresses long-standing gaps in care and reinforces Massachusetts' national leadership in reproductive health care. Thank you for the opportunity to testify. We respectfully urge the committee to offer a favorable report.